Hello, my name is Christina Pagan, and I will be doing my video for the neuro assessment. This is my husband, Nick Humphreys. He will be my patient today. Here is my employee badge. I do not have my student badge, nor can I find it right now, so I apologize. These will be my instruments today, my soft and dull tool. This will be, unfortunately, my fundoscope, as well as my reflex hammer today. And then I have my hand sanitizer. I'm now going to do the room 360 just to show everything that we have in this room. I apologize. It is very... So, fortunately, here's the kitchen. It's been a chaotic week. My husband, my exam surface, if you will. Again, I apologize. It is incredibly messy. Okay, so we will begin. Back around so you can see us. And I have camera propped up as well. Okay. And then this paper here is my guide. I did not have a printer, so I ended up just shorthanding and just writing it out. So the first thing I would do is I would walk into the room. Hello, Nick. My name is Christina. I'll be your nurse practitioner. I will be conducting the neuromuscular exam today. I have gel in my hands. So first we're going to start is with the cranial nerves. There are 12 of them. We're going to start with, I'm going to adjust this camera just a little bit for you guys. We're going to start with the first cranial nerve, which is the olfactory nerve, which is smell. So go ahead and close your mouth. I want you to breathe in through your nose. In through your nose. There you go. So we can see his nasal passages are patent. As well as when we're looking for sense of smell, I have my hand sanitizer here. I'm just going to put a little bit in my hands. Can you tell me if you smell something?
Yes.
And what do you smell?
Hand sanitizer.
Perfect. And then we have the cranial nerve number 2, which is the optic nerve. We would start with the Rosenbaum chart. This is my makeshift one. Go ahead, comfortable reading distance. Can you read the smallest line for me?
Knee flex and extension.
Okay, perfect. And then I have on the list next is going to be having him check his fields for me. So I'm going to have you close your eyes, not close your eyes, I'm sorry, look me straight in the eyes. I'm going to have you close your right eye. And I'm going to place my hand out here. Go ahead and tell me when you see my hand.
I see it.
Okay?
I see it.
Okay?
I see it.
Perfect. I'm going to go across here.
See it. See it. And I see it.
Okay, perfect. And then we're going to the other side. Make sure that we're all symmetrical.
Yep.
Okay?
Yep.
Just stare straight at me.
Yep.
Perfect.
See it.
Good.
See it.
Good.
See it.
Good. Alright, and then we're going to go to Perla. Again, I do not have a fundoscope today, so I will be using his flashlight as my flashlight to check his pupils to see if they are equal and reactive to light. You want to go ahead and get in for me and get your light up. So I'm going to have you stare straight towards me, and I'm going to come in from the side. Good. His pupil went from normal to constricted due to the light. Same thing for the right, and they both reacted the same. Go ahead and shut that off for me. And then we would also check for the fundus. Regarding the fundus, I would use a fundoscope. I would, in ideal conditions, dim the lights. If I dim the lights here, you will not be able to see anything. Essentially, I would dim the lights, and I would take my fundoscope I'm sorry, I shouldn't have had you. There we go. And I would take that fundoscope and I would take a look at his eyes. I'm going to look at his optic nerves, his blood vessels, and see how they're going. Okay. Thank you. Alright, and then now we're going to do the ocular motor as well. I'm going to have you stare straight towards me, and I'm going to have you follow my fingers. So we're going to go out there. Yep, good. And I should have told you not to move your head, but you did it anyway, so I appreciate that. Okay, and go straight in. Perfect. You did well. So then we're going to do cranial nerve number 5, which is just the trigeminal nerve. We're going to look at the facial nerves. So I'm going to test to see if he can feel the same things on both sides. So tell me if you feel on both sides.
Yes.
And is it equal?
Yes, it's equal.
Okay.
It's equal. And equal.
Okay, perfect. Alright, can I have you smile for me? Alright, can you go ahead and clench your jaw for me? And I'm going to look for, go ahead, relax. Go ahead and clench it again. So I'm looking for that, and I'm looking for this. Go ahead, relax. There you go. And then we're going to go to the cranial nerve number 7. We're going to look for the facial nerves. So I want to have you do your eyebrows. Go ahead and raise them and lower them. Raise them and lower them. And then can I have you smile and show your teeth to me again one more time? Perfect. Can you frown for me? Good. Can you shut your eyes real tight? And then I'm going to try to open them. Do not let me open them. Perfect. Okay. All right, and then can I have you? All right. Well, we're gonna move on to cranial nerve number 8, which is the vestibular cochlear. So during this test, I'm gonna be testing your hearing. I want you to close your eyes during the test. You don't have to do it just yet. Essentially, I'm going to rub my fingers and make this sound. Can you hear that okay?
Yeah.
Okay. So when I have you close your eyes, I'm going to place my hands on both sides of you. You let me know which side you hear it on. Okay? Go ahead and close your eyes for me.
Left. Right. 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 Left.
Perfect. And he passed. And then we will do the gag reflex. So it'll be the glossopharyngeal, and we're going to do the vagus. We do not do these on normal patients who are alert, awake, and oriented, who we do not suspect anything is abnormal. The way I'm going to be testing this today is having him say, ah. Good. And then I'm going to take this and just take a look at his palate. Go ahead and do that for me one more time. And say, ah. Good. All right, and then I want to have you, at the same time, we're going to do the hypoglossal number 12 for the cranial nerves. I'm going to have you stick your tongue out again real good, and then move it side to side for me. Perfect. All right, it moves both ways equally. And then we will do the cranial nerve number 11. And what we're looking at is we're doing the spinal accessory nerves. So I'm going to have you shrug your shoulders. Go ahead and shrug your shoulders for me. And I'm going to have you resist. I'm just going to put pressure, resist me putting that. Okay. And I'm going to place my hand on your left cheek. And I'm going to have you turn into my hand and resist. Okay. I'm going to have you do the same thing. Good. Alrighty. So that concludes our cranial nerves. I forgot to say that the patient is appropriately dressed for the occasion. As a patient, he's in his street clothes. It is not too cold, it's not too warm in the house. He's got the appropriate wear on for that. Can you tell me your full name and date of birth real quick?
Nicholas Humphreys, date of birth is January 18th, 1996.
Perfect, thank you. And where are we at today?
Our house,
Where's our house?
407 South Hollybrook Drive.
Perfect. And then what day is it?
It is Wednesday,
Okay, do you know what the date is?
September 17th,
Perfect.
2025.
Perfect, okay. And then what are we doing right now? What's the situation, I guess? We're just doing an exam.
I'm doing an exam.
Normally I wouldn't tell you that. I'm sorry, it was not a trick question. So normally I would have done that at the beginning of the exam. I kind of jumped ahead of myself. So right now we will do the reflexes. My reflex hammer will be my husband's phone that still has the flashlight still on. There we go. Alright, can I have you actually stand up for me this time? And I'm going to take this left arm. I'm going to hold it like this. Keep it nice and relaxed. I'm going to place my hand on that bicep tendon. And I'm going to take the edge of his phone and tap my thumb. I notice a little bit of a jerk, and that's good. And then I'm going to have you do the same on this side. And I'm a bit uncoordinated, so I apologize. Again, tapping my thumb here. I'm going to have you walk in just a little bit, just so that we can kind of see. Okay. And now I'm going to test your triceps. So I'm going to have you relax your arm here. And again, I'm going to put my thumb on your tricep tendon back here. I'm going to have you rotate just a little bit so that the camera can kind of get that angle. But have my thumb on the tricep tendon right there, and I'm going to hit my own thumb again. Make sure your arm is really relaxed. You're a little bit tensed here. Do you not trust me?
It feels relaxed.
Alright, and then I'm going to go to the other side, make sure we're symmetric. Okay, good. And I'm going to have you sit down for me again. And then I'm going to try to angle this camera just a little bit more so that so I'm going to do your patellar reflex here. We're going to look for the patella first, and then once we have done that, I'm going to strike your patella. There we go. And then I'm going to strike this patella as well. Look for it first. Alright. I'll do that one more time. Alright, that one's a little bit less than the other one. That's okay. And then I'm going to check his Achilles. I don't know if we can, yep, we can see that. Okay. So I basically wanted to have his foot stretched here so that I'm stretching the tendon gently. Have it nice and relaxed otherwise. And I can feel him reflex against me. And then again, stretching the tendon here. Perfect. Okay. Alright, that concludes the reflexes. I'm just going to fix the camera again. Okay, perfect. Now we're going to go on to coordination. We're going to test the upper body coordination first. So I'm going to have you do rapid movements here. I'm going to have you place your hands on your thighs, and I'm going to have you flip back and forth quickly. between the two. Perfect. He is symmetric in how he is doing that, so that's good. And then I'm going to have him point to point. So I'm going to have you use your left arm, and I'm going to have you reach my finger, point to my finger, and then point to your nose. Point to my finger, point to your nose, touch my finger, touch your nose, touch my finger, touch your nose. Okay? And I'm going to have you do the same thing with your other hand here. Touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Good. Now we're going to check your lower extremity. Much like the upper extremities, I'm going to have you do foot pats instead of hand pats. So you'll want to tap the floor. And you're going to want to flex that foot there. So instead of picking up your legs, you're just going to tap the feet. There you go. Good. Good. And then the last one I'll have for the lower extremities, I'm going to have you do the heel to shin. Go ahead and do that. Okay, and then do the other way. Yep, perfect. Alright, and then now we're going to walk across the room. I'm going to check your gait. So if I could have you please stand up. Have you walk to the spice rack. Or, I'm so sorry. Go ahead and walk to me. And then walk back for me, please. Perfect. And then on the way back to me, I'll have you do the heel to toe walk, please. And then for the heel to toe, they want, it's okay, we'll do that. I'm looking for your balance here. So sorry. Perfect. And then going back towards the spice rack, I'll have you walk on your tiptoes. Okay, perfect. So then next we are going to do sensory. I'm going to have you do pain and dull. So I'm going to have you take another seat again. Yep, there you go. And we're going to do the forearms. We're going to start with those first. Actually, I'll start with your shoulders. So essentially what we're going to do is I'm going to have a quote, a sharp edge and then a dull edge. And I want you to tell me what you feel with your eyes closed. Mm-hmm. You tell me where you're feeling it and if it's sharp or dull. Okay? Go ahead and close your eyes for me.
Sharp left shoulder.
Okay.
Do it again. Dull right shoulder.
Perfect.
Sharp right forearm. Sharp right forearm.
Okay.
Dull left forearm. Sharp left forearm.
Okay, can I have your hands out for me? Okay.
Sharp left thumb. Dull left pinky. Sharp right pinky. Sharp ring finger. Dull right thumb.
Okay.
Dull left thigh. Dull left thigh. Dull left thigh. Sharp right thigh. Dull right thigh. Sharp left thigh.
Okay, and then on here.
Sharp left big toe. Dull left fourth toe. Dull right big toe. And then dull right fourth toe.
Okay. Perfect. He got all but the thighs. When I had repeated the left thigh more than once, after going from the right to the left, he then correctly identified sharp on the left thigh. Originally, he had said it was dull. So I went back to see what he was picking up then. Okay. And then we're going to test the flexion and extension. I'm going to have your upper extremities, so I'm going to tuck your elbows first, see if they're equal and strong or weak. Okay, so what I have you, I'm going to push up, resist, good, and I'm going to push down, good. So his strength at the elbows is bilateral and strong. So I'm going to have you place your hands like this, make a fist with both hands. I'm going to push downs on the top of your hands. Go ahead and resist me, so don't let your wrists bend. Good. He has equal strength in his wrist. I'm going to have him hold out his hands again. We're going to do grip strength. I'm going to use 2 fingers so he doesn't break my fingers. Go ahead and squeeze my fingers as hard as you can. Hold it for a good 2 seconds. 1 Mississippi, 2 Mississippi. Perfect. His grip strength is equal, bilateral, and strong. Sorry. And then I will have him do the finger spread. Go ahead and spread your fingers out. Keep them spread out. Don't let me close them, okay? Good. All right, and we're going to do the same thing with the lower extremities. We're going to, I'm going to have you raise your leg and push it against my hand. Good. Raise your leg, push it against my hand. Good. I'm going to have you do you mind backing up just a hair for me? I'm sorry. I'm going to have you pull in on my hands, and then I'm going to have you resist my hands on the outside. Good. I'm going to have you push down on my hands, and I'm going to put pressure down your feet. Just go ahead and pull back. Perfect. Good. All right. For the last test, we're going to do some other signs. I'm